how diets play a role in helping us to lose weight and maintain a healthier body weight. So, we're going to share with you some really cool studies about how diets work, what some of the interesting mechanisms, what's the pros and cons of some of these diets, the advantages and disadvantages, so you as a provider have a general understanding of what's the general concept behind those. So when a patient is telling you, I'm trying to lose weight and I'm trying this particular diet or a different diet, you have an understanding of what this diet does and if it's going to be a good fit or not for this particular patient. So the reason why we picked the topic for today as weight gain is because we know that is such a serious problem in our country. So right now the statistics are showing us that 3 out of 4 adults are over the optimal or healthy weight. When it comes to obesity, the CDC reports that in the last 20 years, obesity went up from about 30% to about 42%, which means that currently 4 out of 10 adult Americans are obese. And from a medical point of view, gaining weight significantly impacts all the different body functions and different systems in our body. So we know that it is really important for us as healthcare practitioners to be able to provide guidance and evidence-based strategies to our communities. So let's start to warm up a little bit with a little quiz. So which of the following conditions are associated with weight gain? And I'm giving you here all the options. So you got 1, type 1 diabetes, 2, type 2 diabetes, 3, hypertension, 4, liver disease. We got E, mood disorders, F, increased risk of cancer, G, all conditions including type 1 diabetes, and H, all conditions. So which one do you think of those conditions are associated with weight gain, and which one of those, through the process of elimination, might not be associated with weight gain? I'll give you a few seconds. Think about it, and you can put it in the chat. We'll love to see your comments. Which one do you think it is? Which answered? So if you said G, all conditions including type 1 diabetes, you are correct. So as a general statement, all of these conditions were found to be associated except for type 1 diabetes, which is an autoimmune condition. Now, we know that, as I mentioned, obesity can increase the risk, and we're showing that in studies. There's a strong association. If somebody gains weight or they're obese, that it significantly increases the risk of metabolic conditions, hypertension, cardiovascular, right? All of those, mood disorders, and even some types of cancer. So let's take a look at a couple of pictures that show the association between weight gain and these medical conditions, right? Just to elaborate on that. So in this particular picture, you can see how obesity increased the risk of not only hypertension, type 2 diabetes, dyslipidemia, and some types of cancer, but it can also increase the risk of reproductive disorders, and we already mentioned here liver disease. Let's take a look at the outer picture. This is a really interesting picture from the National Cancer Institute. And it was posted by the National Institute of Health. And you can see here all the different types of cancers that are associated with overweight and obesity, from ovary cancer, colon cancer, pancreas, thyroid cancer, breast cancer, liver, gallbladder, upper stomach, esophagus cancer, multiple myeloma, right? So we're looking at a broad types of cancer, and a lot of it is because the adipose tissue, we know that today that the adipose tissue it's not just aesthetically larger tissue, right? It's a very much active, metabolically active tissue that secretes different inflammatory cytokines and secretes different hormones. So it could lead to dysregulation or contribute to dysregulation that could also increase the risk of different cancers. And so in today's, what I really want you to get out of today's conversation and discussion is, one, what's the roles of some of these diets? How can it be helpful, and what the disadvantage of those diets? And second, start thinking about the root causes, some of the root causes of weight gain. And even if you are only practicing, you're just focusing, your focus is family medicine, which is very broad, right? Or you're focusing on orthopedic conditions, or if you're focusing on women's health, or if you're focusing on oncology, or if you're focusing on whatever it is specialty that you're looking at, or neurology or psychiatry, if your patient is struggling with excess weight or obesity, it could definitely impact their condition, the condition that they come to see you for. So that's why it's really important for all of us to understand how these diets works and who they might benefit from. So, Dr. Chill, it's a big topic, but I'm really glad that we're getting into it.
Yes, absolutely. Especially as functional medicine practitioners, right? We need to understand all the different types of diets that are out there, and we need to understand who they're great for, who they're not great for, because you will definitely be asked about these diets. So I'm glad that we are going through some of the major diets that are out there, the advantages and the disadvantages, so all the practitioners here can understand who it might be good for their patients or their clients. And before we kind of get into some of the diets and then which ones are going to be beneficial for your patients, let's throw some more data at you regarding diets and how many people, actually Americans and adults, try to lose weight every year. There's actually every year, there's about 4 out of 10 American adults that try to lose weight. And about an average American will attempt to lose weight by dieting at least one diet every year. So that's a lot of people. So this is why it's really beneficial for us as practitioners to understand all of the different types of diets that are out there, and to understand the clinical applications of each of these diets. And as I mentioned earlier, there's a lot of diets. There's thousands of diets that are out there. So it's really hard to know which diet actually works. So today we're going to look at a few of the most common ones that you will be asked about. And then we're going to go into which types of these diets works, the advantages, and then the disadvantages. So the first diet that we want to look into and talk about is actually called Weight Watchers. Many people have heard about this. So let's take a little quiz on Weight Watchers really quick here. The question is, which celebrity previously endorsed Weight Watchers and resigned last year? Is it A, Sarah Ferguson? Is it B, Jennifer Goodwin? Or C, Oprah Winfrey? I can actually see the picture of the celebrity doing Weight Watchers right now. So I'll give you a few moments. And you could post your answers or comments in the chat if you'd like. And again, which celebrity endorsed Weight Watchers but resigned last year? If you chose C, Oprah Winfrey, you are correct. She was their spokeswoman for several years, and then she resigned from the board in early 2024. Now, Weight Watchers, you will get asked about Weight Watchers. So the information on that is they are a point-based system where each food and each beverage has a point value, and this is based on its nutrient levels, and energy density. The members are given a daily point limit, and then they have to stay under that daily point limit. And this is a subscription and a membership base. So the advantage of this program, it's based on the principles of healthy eating, exercise, and it has a really strong supportive environment, such as coaching and workouts. And this can all be done on the phone or through telehealth. And the cost will start from about $65, and it will have some sort of monthly fee. Now, there are a few disadvantages and challenges with the Weight Watchers diet. Number one, counting points and tracking everything you eat every day can be extremely tedious, and there is a concern of creating an unhealthy relationship with food through doing that tracking of every single thing that you're eating on a daily basis. And then the second concern is going to be all the foods are allowed. This means this includes fast food. That is allowed as well. So this can lead to a consumption of food that increases inflammation, even though they're under the point value. That can still be considered an unhealthy type of food. A third concern is the effectiveness was not very significant when compared to a control or education group. For example, a systematic review, and the study was published in 2015, it was 39 randomized control studies, and it concluded that over 12 months, that the people in the Weight Watchers group had a 2.6% loss of body weight in comparison to the control group. Now, that's not a very significant amount of weight loss if you are dieting for the year. So the effectiveness of this program wasn't showing that it was very effective. Now, another concern was that there was another study that was reported that weight loss was very significant for some participants, but about half of the participants regained the body weight within 3 years of that. So many patients may have significant weight loss within the first time of joining Weight Watchers, but most of them will regain that within 3 years. So that is information about Weight Watchers that you can share with your patients who may be interested in joining Weight Watchers or something similar to that.
Thank you, Dr. Chill. I appreciate it. I know that Weight Watcher is one of the famous ones, right? That's
Yes.
That's what we started with them, and that kind of gives us a good overview. And again, it's when we just to kind of add on to what Dr. Chill was saying is that that it's when we look at a certain diet, we don't necessarily say this diet is good or this diet is bad, right? And we're definitely not taking any sponsorship. It's mostly we try to look at it from what the research is standing for, what the research and evidence is showing us, and then what's the benefits and disadvantages of each diet, right? So we can kind of help us to kind of fit the best diet for the patient, right? So that's what we try to do. So this is not to say that Weight Watcher is not a good diet or any of the diets that we're going to talk about. It's just really to give you the information so you understand how it works better, right? So let's dive into the second diet, which is intermittent fasting. And intermittent fasting is super interesting. There's some really interesting medical articles about it. Essentially, what the whole concept of intermittent fasting, and this is kind of ties in a little bit to studies from the anti-aging field and some studies from weight and some studies from inflammation. So there's really interesting kind of data when you look at it, right? But the center of it essentially is just focused on letting the body rest from food for a certain period of time, right? And then there's another theory of intermittent fasting that we can improve our health if we follow the natural circadian rhythm, which means that we essentially don't eat anything at nighttime, where our body's supposed to be resting, right? So there are, one of the challenges with looking at, I looked at dozens of intermittent fasting studies. One of the challenges is that there are so many different types of intermittent fastings. For example, one common type of intermittent fasting is to fast from nighttime to morning, from the evening to the morning time. So essentially, you don't eat anything from, like, you eat your last meal at 5, and from 6 p.m. to 6 a.m., you don't eat anything, right? Another different type of intermittent fasting is called alternate day fasting. What alternate day fasting essentially means is that you eat the normal amount of calories all throughout the day. Then the following day, you either just cut your calories to a 25% of what you typically eat, or you don't eat at all. You completely fast. So it's sort of like a day on, day off, day on, day off type of a diet. And so let's warm up with a little quiz about intermittent fasting. And the question is, which of the following is not true if you do not eat for 6 to 8 hours? So what happens physiologically in our body when we don't eat for 6 to 8 hours? Option A is your blood glucose level drop. Option B, your body starts to burn fat. Option C, your body releases glucagon. So which are the followings are true or not true, right? So type in the chat. What do you think it is? A, B, or C? Which one is not true? Okay, so if you typed in the chat that the wrong answer is B, then you are correct. Fat burning typically begins after approximately 12 hours of fasting and escalates between 16 to 24 hours of fasting. So to actually start breaking down fat, we have to fast for a longer period of time than the typical intermittent fasting, which is typically about 12 to 14 hours. So what are the benefits of intermittent fasting, right? There's a small, interesting study. It was published in the Journal of Scientific Reports. And the research took 14 adults of 60 years old or above, and they all had metabolic syndrome, right? And they placed them under a 14-hour fasting every evening, which meaning that no food or water from dawn to sunset. So as soon as the sun goes down, they stop eating, right? And then as soon as the sun comes up, they go back to eating. Now, the interesting part is that what made it, in my opinion, much easier to follow is that there was no restriction in the amount of calories that they could eat during the day. So when the sun is out, they can eat as much as they want and pretty much whatever they want, right? That's like every dieting person's dream, right? Eat as much as I want, eat whatever I want, right? But they could not eat when the sun goes down. They couldn't eat. The whole concept of this process of intermittent fasting is to allow the body to rest. So let's take a look at a picture that describes the results that they received from doing this particular diet. So we can see here on the left side, they took blood samples, and then 4 weeks down to sunset fasting, right? And you can see on the right side the results that they got. So the changes were really interesting. Intermittent fasting from dawn to sunset for 4 consecutive weeks induced anti-cancer serum proteome response and improved metabolic syndrome. So essentially, some of these anti-cancer proteomes, right? So these are essentially several different proteins that were upregulated in the bodies of these individuals who fasted overnight. And these proteins, they play a role, a very important role in tumor suppression. They also allow support DNA repair. They support insulin, healthier insulin signaling, and they downregulate several tumor promoting proteins. So what they found is, one, like in terms of healing, what we can learn from it, it might be beneficial to not eat at nighttime, right? Because that allows our body to regenerate, to do the natural process of regeneration, and that our body is designed to do and do very well when it's allowed to do it. And also they found several improvements, such as the waist measurement reduced by an average of 2 inches, systolic blood pressure reduced by 4 points, diastolic blood pressure reduced by 2 points, insulin reduced by 1.5, and then level of adiponectin and leptin improved. We're not going to get into these hormones, which have a really important role in our metabolism and our weight gain and our body weight. We do get into more of these different hormones in the functional weight loss program, but essentially it is a small and short study, but it does show that intermittent fasting could benefit patients with metabolic dysfunction, and especially when following the natural circadian rhythm that support the healing process in the body. And we do not need more studies. We do need to look at more studies that kind of confirm this theory. But in the 2 months certification program, the functional weight loss consultant certification program, we do take more time to look at our hormones and how our natural hormones play a role in us gaining weight, and how can we eat according to our hormones, right? Including which type of supplements we can take, what type of herbs might help us to adjust our hormones to have better metabolism. Now, let's take a look at the disadvantage of the intermittent fasting. So one of the disadvantages, and this is why it's not going to be a good fit for everybody, is when we don't eat. You remember that little quiz that we had just a few minutes ago? When we don't eat anything, right, what happens is our blood sugar drops. Now, that could lead some people to struggle with or experience dizziness, nausea, insomnia. If they don't have an ability to regulate their blood glucose levels properly, then they can wake up, because our brain works on glucose. It needs this constant supply of glucose, and without it, you'll wake up, right? It could also cause headaches, can cause mood swings, right? I think it's called hangry, right? We got a term for it. Might not be a medical term, but it is. Hangry is a term that we're aware of, right? If we don't eat for a long period of time, we get very kind of upset or edgy, right? And then, of course, feeling weak is another results of this hypoglycemia. Now, another factor to consider as a disadvantage is that this is definitely contraindicated with people with eating disorders. We definitely don't want to put them on any sort of diet or that could mess up their connection with food, or put them on a diet that reduces their consumption of food. And then pregnant, lactating women, and of course children should not be doing intermittent fasting. That's just very general guidelines. And then intermittent fasting does increase the risk of losing muscle mass. So we should be aware of it. Older adults, especially, that are, might be a little bit more prone to losing muscle mass. We want to make sure that that doesn't happen, because if we lose muscle mass, the end result is our basal metabolic rate, which is essentially how many calories do we burn at rest, right? That's going to be decreased. And then the end result of that is that we burn less calories. And of course, once we stop the diet, we can gain more weight, right? We can gain it with interest even. And of course, with loss of muscle mass, we have to be careful with older adults because it also increases the risk of falls. And then the biggest advantage of this diet, like any other diet, is that it's hard to maintain for a long time. And again, it really doesn't solve the underlying problem that led to gaining weight from the beginning. But periodically, the intermittent fasting has some really good studies, really good value in healthcare practice when appropriate, right? And of course, we dive much more in depth into that in the functional weight loss program. So, Dr. Chill, I know that we've talked about intermittent fasting before when we talked about like other conditions. And it's good to look at some of the data, even if it's small scale studies, we can learn from all of those. And I know that I'm kind of excited about the next segment because you're going to be talking about one of the very, very, very common diet that patients are taking upon themselves, sometimes kind of secretly. They don't tell their medical practitioner that they under those diet because they don't think that the medical practitioner know anything about those diets, right?
Right. And this is a very popular diet, and many people have either tried it themselves or are on it right now, or they will be wondering about this. And this diet is the paleo diet or the Paleolithic diet. So many of us have heard about this. So we want to talk about this diet and the clinical applications of this diet, who it's good for, who it might not be good for, right? So with the paleo diet or the Paleolithic diet, this is a diet that is focused on a consumption of high protein and high fat with less carbs. This is, again, can be considered also the caveman diet. And this is really just an interpretation of what humans ate during the Paleolithic era or the Stone Age era. And this is anything that they could gather, pick, or hunt. And the concept behind this diet is that it started in the 1970s, and it is typically foods that were where they could gather, pick, or hunt. So these foods included things like plants, right? So this is their fruits, your root vegetables. These are all vegetables except for the vegetables that are high in starch, such as potatoes. It also includes things like nuts, legumes, and animal proteins are going to be a big source for this diet, such as eggs, meat, chicken, and seafood. Now, we all know that the paleo diet is also referred to the Paleolithic diet or the caveman era, as I mentioned. And this is going to be a restriction on carbohydrates and an increase in the fat and the protein. And there are many different versions of this diet. For example, one version is going to allow a third of the energy from carbohydrates, and then a third from fats and 35% from protein. And then the diet that most adults will contain about 45 to 65% carbohydrates, right? This is the normal type of diet in comparison to the paleo diet, which is about 30%. So it's significantly lower in the amount of carbohydrates that they're doing. And then in some paleo versions, about half of all carbohydrates are cut out. So now, what are some of the advantages of the paleo diet? Number one, this diet is going to be really high in essential vitamins and minerals because this is high in vegetables, nuts, oils, and animal proteins. And then the fruits have polyphenols. And also the polyphenols are also found in other vegetables, in herbs, in nuts, and in tea, which is all included in this paleo diet. protein and then healthy fats found in nuts and seeds and olive oil, seaweed and fish are also components, which also has some anti-inflammatory properties that are associated with them. Number two, this has been shown to support a reduction in body weight. A systematic review and a meta-analysis. This was published in the Nutrition Journal in 2019, and the authors reported that an average loss of body weight was about 3.52 kilograms or 7.7 pounds. And then most of the studies were conducted between 3 to 24 months. So this can be a diet that can be done in a more long-term approach. And if you want to read a little bit more about that diet, again, it is called The Influence of Paleolithic Diet on Anthropometric Markers in Chronic Diseases. And this was a systematic review and meta-analysis, and this was done in the Nutrition Journal. Now, we want to also discuss some of the disadvantages of this diet. Now, reducing carbohydrates. Remember, most Americans in general will contain about 60% of carbohydrates when the paleo diet is about 30 or even half of that, right? And then when you are reducing that amount of carbohydrates and sometimes fiber as well, this may lead to some digestive symptoms. And with some patients, this can actually change their microbiome as well, and because of the lack of diversity. So that is going to be one disadvantage that you want to educate your patients about who are interested in doing this diet. Another disadvantage is an increased consumption of meat is associated with increased risk of colon cancer. And then the paleo diet is really high in animal-based protein, and this can increase TMAO concentrations, which is trimethylamine N oxide. And this is a small colorless amine oxide. So I want to show you a picture exactly on what TMAOs can do in our body. So here we are seeing that if you are consuming animal protein in higher amounts, this includes the paleo diet, right? This is going to contain higher amounts of choline, phosphatidylcholine, and L-carnitine, and this can be converted to the trithylamine or TMA by the gut bacteria, and then it's converted in the liver to trithylamine N oxide or TMAO. And what happens with TMAO is that if there's long-term exposure to this, this was found to be associated with an increase in a risk of cardiovascular diseases and atherosclerotic plaque by reversing cholesterol transport, and it forms some foam cells, and then there is accumulation of cholesterol in the macrophages. So long-term effects of TMAO and long-term effects of the paleo diet can be detrimental to some patients who are at risk of cardiovascular disease, because this can continue to increase their risk of cardiovascular diseases. So this is really important to understand because this is such a popular diet, and we need to understand the risks and the benefits so we can share this with our patients and our communities.
This is, by now we already understand how 3 of the major diets that patients could encounter when they struggle with weight gain or obesity, and a lot of our patients go to Dr. Google, right? Mm-hmm. That's the first place they go to because they don't believe that their medical professional understand much about diets. So for that reason, most patients, at least from my experience, most patients won't ask their primary care practitioner about diets, right? Which is unfortunate. So for us, it's really helpful to even just understand some of the basic concept of these diets and know, for example, that you're mentioning, like when somebody goes on a paleo. I've seen patients lose a few pounds just by going on a paleo, right? Just go eat higher amounts of protein, higher amounts of fat. The interesting part, and as soon as you cut down on carbs, that's something that across the board is kind of show that we're going to lose some body fluids, and we're going to lose some of the fat tissue, get some of the body weight. The problem with that is that I've seen patients that we did some work with them. They had some digestion problems. We did some work with them, or diabetes or fatigue or joint pain, right? We did some work with them for 3 to 6 months, identify the root causes, like that's what we do with functional medicine, right? And we kind of educate them. Now they got better. We get a significant improvement, either reduction in usage of drugs or improvement in their symptoms, or both. And then we educate them, and then we kind of schedule a check-in once in like 2 or 3 months. So just tell them, listen, we're here for you. We educate you about how to take care of your body, and we're here for you for whenever you need us. And I had 2 patients come back and say, a few months later, and their symptoms came back, and their digestion symptoms came back, or headaches or whatever it is. And what we found out is that they went on a paleo because they wanted to lose weight, right? They didn't come to see us for losing weight. They came to see us for their medical conditions. They wanted to lose some more weight, right? And when we look at their symptoms, those were some of those symptoms of dysbiosis, of gut dysbiosis. And when we looked at some of the labs, they showed an alternation in their gut microbiome. So what we have to consider is that when we change our diet and we eliminate fat, we eliminate complex carbohydrates, or reduce our fiber consumption, it can also alter our gut. And now there's nothing that feeds, right, those beneficial bacteria. They're feeding off fiber, right? So we have to make sure that those diets are done, are done when you are monitoring your patients, right? And seeing, kind of like checking in with them every 2 weeks, how they're doing, right? So that's where we're here for. We're here to help you, provide additional training so you are familiar with all of these concepts. So let's go into one of my favorite diets, actually, and that's the Mediterranean diet. So now we're all familiar with the Mediterranean diet. We heard about some of the principles. This concept actually started according to one report in 1950s. There was a Dr. Ansel Keys, through research that showed a connection. So he published some research showing a connection between the Mediterranean diet and improvement in heart health. And the concept actually started by some healthcare practitioners and researchers that have noticed that the mortality rates associated with cardiovascular diseases are significantly different between Westerns and Europeans and the Mediterraneans, right? So for example, there's lower mortality rates in the Mediterranean due to cardiovascular conditions, and there's lower mortality rates in some places in Europe that were observed. And even though, for example, the consumption of fat is significantly higher, right? So we all heard about the fat fad, right? That's fat is bad for you. But when you look at, for example, Italy, they have a lower rate of heart diseases than we have here in the US, yet they consume significantly higher amount of olive oil. Pretty much everything in the Italian cuisine is with olive oil, almost everything, right? So they just put olive oil on everything. They cook with olive oil, they stir fry with olive oil, they put olive oil on everything, right? Yet they have lower rates of cardiovascular disease, or mortality rates due to cardiovascular diseases. Now, another really interesting example is the French paradox, which describes how the French people have a lower rates of coronary heart disease death, lower rates of mortality due to coronary heart disease, despite the fact that they eat butter in everything, right? Which butter, we know you eat butter, it increases your saturated fat. So these concepts kind of challenge, they challenge what we think about our foods, right? And a lot of what we were told early 2000 and the 1990s, that butter is dangerous, right? And fats are dangerous for us. And I was really surprised. Years ago, I visited France, and it was really interesting when I kind of went back there again with my wife about 6 or 7 years ago, and I was seeing that there were so many people. Like, it's rare to see an obese person in France, at least where we were, in 3 places in France. And it was really interesting to see that most of them were at healthy weight. But I was looking around in the morning, we're taking the train, which was a nice ride, or we're just walking in the street. And I was telling my wife, they eat those croissants. It's like they eat that all day. They eat the croissants. They in some places, in some coffee shops, they have coffee shop chains that put everything in croissants. Like, they don't even serve sandwiches anymore. It's just like, you want meat, it's in croissants. You want, like, everything they put in croissants, and everything has tons of butter in it, right? And they're all either skinny or have healthier weight. So that's, again, the French paradox of, like, really understanding that sometimes it's not fat, sometimes eating fat or eating more calories. Sometimes it's just there's something that leads to metabolic dysfunction, and we got to figure it out, right? Is it something in our hormones, our gut, or something else, right? We got to figure it out. So let's take a look at this really cool study from the Journal of Medicina, published in 2021. And you can see here some of the kind of principles of Mediterranean diet in the center, where you can see fruits, vegetables, whole grains like brown rice or whole wheat, legumes, beans, and lentils play a significant role in these, like the complex carbohydrates that have a lot of fiber, right? And then we got nuts, we got seeds, we got fish, we got seafood, extra virgin olive oil is the primary fat source, and then moderate amount of dairy like yogurt and cheese. Notice that on top of the pyramid, which is like very small amount, they eat a little bit of butter and a little bit of meat, and maybe some sweets, but it's like really, really small in comparison to the bottom of the pyramid, which is social structure, right? Physical activity, and then mostly eating very whole foods, right? It's like fruits, vegetables, and whole grains. So there are several benefits that we're looking at from this particular study. We can see here that we got reduction in oxidative stress, reduction in inflammation, reduction in chronic low-grade inflammation, right? Reduction in reactive oxygen species, which cause damage to our cells, cause damage to our pancreas, cause damage to our, increases the risk of insulin resistance, and then it helps to improve the function of the immune system, right? This particular study looked at Mediterranean diet as a potential strategy against COVID-19 infection, and what's the benefit of it. But we're taking a look at this study because it really shows us the overall health benefits of the Mediterranean diet. So there's another really interesting report that showed that they took individuals, they looked at different studies, and this was published in the American Journal of Medicine in 2016. And the authors reported that 12 months of following the Mediterranean diet led to a weight loss between 8 to 22 pounds, right? And that's really beneficial. And you don't have to fast, you don't have to count calories. Essentially, you're just following these healthy principles of the Mediterranean diet, right? So start every meal. For example, we used to instruct every patient, start every meal with leafy green vegetables or different types of vegetables, except for a potato, right? We don't want a lot of starchy vegetables. Start your plate with vegetables. Make that like 40 to 50% of your plate. Everything else is you can have a little bit of meat, some legumes, rice, whole grains, kind of a diverse diet, and you can eat as much as you want, right? That's what we used to tell our patients. Now, let's take a look at the disadvantage of the Mediterranean diet. So, Mediterranean diet, the disadvantage is that it does require prep time. So, you need to figure out how to cook with vegetables, spices, olive oil, right? We talk a lot about tips in the functional weight loss certification. So we talk a lot about like tips on how to help your patients to follow the healthy principles of diet, but we don't call it diet, right? We call it just healthy principles of lifestyle and eating, right? And then beans and legumes, another disadvantage is that beans and legumes could cause stomach discomfort with some people with digestion issues, such as people that are prone to IBS. It is lower. Another disadvantage is that it's significantly lower in animal meats, which is harder for some people unless they're vegetarian. So we definitely go deeper into what can we do and what's some of the principles we can follow. But I wanted to share this with you because this could be really beneficial to some of your patients. So, Dr. Chill, I feel like we covered some important diets.
Absolutely. We covered the main ones that our patients often ask us about, right? And what are the benefits of them? So it was a really good conversation.
Yes, absolutely. So with that, we want to kind of transition and conclude with our next segment, which is what are some of the challenges that your patients can face when trying different diets? So Dr. Chill, I'll let you take this one.
Yeah, so I think the biggest thing that we want to do is give you the main takeaway about diets. And we're going to do this through a quiz. So the quiz question is, what are the biggest challenges with diets? A, is it eliminating foods? This is not a long-term situation or a solution. B, it requires a significant amount of willpower and long-term commitment. C, reducing calories could reduce your metabolic rate. D, diets do not address the root causes of weight gain. Or E, all of the answers are correct. Which one of these are the main key takeaways to this whole topic? I'll give you a few moments to think about this. All right. So the answer here is E. All of the answers are correct. The thing with diets is, if you're eliminating foods, this is not really a long-term solution. It's going to require a lot of willpower, and reducing calories isn't the answer. And diets do not address the root cause of weight gain. And I want to show you a picture on some of the diets and some of the fads that are occurring with these diets. And many diets are presented as a quick fix for overweight and obesity. But the reality is that diets can be beneficial if you're using it appropriately. And in most cases, with diets, they are not a good long-term solution when you are presenting this to your patients. So this is from the Frontiers in Nutrition. And this is going to talk about some of the facts and the fictions and the problems with diet. You can see here that with fad diets, this is often just a quick fix for something that is a long-term problem, right? Oftentimes, it doesn't talk about the physical activity. Sometimes they have rapid weight loss, which isn't always healthy. There is inconsistent scientific evidence, and it can be detrimental for some with chronic diseases. This is where we come into play to understand what their chronic issues the concerns are, and we have to understand those chronic diseases and if these types of diets will be beneficial for our patients in the long run. Other issues include maintaining these diets, and then it's also just talking about promoting short-term changes. Some of these can be nutritionally inadequate, And there are oftentimes missing food groups with these fad types of diets. Now, we will dive into the how to address weight loss or weight gain in the functional weight loss program. And Dr. Cohen is going to give you some more information on how you can join that certification program.